All right, I think we'll go ahead and get started. So again, good afternoon, everybody. My name is Karen Lee Harrington, and I'm with the Maine Health Data Organization. And I have on the call with me a few of my colleagues that will be available to answer questions that you may have while this time that we have together. And Kate Mullins from our data vendor, HSRI, I will be turning part of this presentation over to, and she will be walking you through some of the specifics. So with that said, just a few reminders. If you could keep your line muted, that would be great. And please feel free to use the chat feature to submit any questions as we walk through the presentation. And at the end, we will address as many of your questions as possible. And for those that we can't, we will get back to you on, and we'll distribute those vis-a-vis posting them on our website. So with that said, again, welcome. I know you're all very busy with competing priorities, so very much appreciate the time that you are spending with us today to talk about some new requirements that are part of a new law, Public Law 2022, Chapter 603. Specifically, we're going to focus on the behavioral health care non-claims-based payment data that is required, as well as the data specific to substance use disorder. We'll do a refresher on Chapter 247, which is the non-claims-based payment rule. We had originally briefed you, many of you, on this last year, at the end of last year. So we'll talk a little bit more about that, and then we'll go over resources that are available and then answer any questions that you might have. So Public Law 2022, Chapter 603, and you'll see the specific reference in statute, is a new law that essentially requires the state to report on the amount of spending specific to behavioral health care. And some of you may be aware that we do this several years ago. A law passed where we report on primary care spending in the state. And the law requires that the data source that is used for these reports is MHDO's claims data. And so when the discussion was happening this last session around behavioral health care spending, it became clear that the law needed to include the non-claims-based payments specific to behavioral health care that payers may have as part of their programs and their associated member months, as well as the total payments associated with the substance use disorder data that are redacted from the payer's claims data submissions as required under federal regulation, which is 42 CFR Part 2. And as part of that submission, we're looking for the methods used to redact, and this is all what's defined in the law, the methods used to redact the substance use disorder claims, the specific code lists that are used for procedure codes, revenue codes and diagnosis codes, provider types, and any other detail in the claim that is required to select the claim that you're going to redact. The devil is always in the detail, as you all know. So what we will be working on, Kate, if we want to go to the next slide, over the next several weeks is figuring out how to incorporate these new data elements into Chapter 247, which again is the uniform reporting for non-claims-based payments. The behavioral health care report that I referred to earlier is due, the first annual report, January 15th of 2023. So it made sense to talk to you all about what's coming and then have a follow-up webinar, and Kate will get into the timing in a few slides, about when all of this will be ready for you to start reporting this data and when it's due. But we wanted to give you a heads up so you can start thinking about this as we start to build it out. And then just as a reminder, The Chapter 247 non-claims-based payment data is the new rule that was adopted by our board, again, as a result of legislation that requires the annual reporting of primary care spending. Now that we've added, or the legislature has added, behavioral health care, we will amend the rule as we just discussed. And so this is just an overview of what non-claims-based payments mean as defined in the rule. And just a reminder that annual registration was due on February of 2022. The first submission of data is due August 31st of 2022, and that's for the period of calendar year 2021. And then there'll also be an annual attestation, which is due at the same time that you're submitting your data. And again, that's part of the requirements in the statute. And at this point, I'm going to go ahead and turn it over to Kate. And again, please feel free to use the chat feature, or we'll open this up to questions at the end of Kate's comments.
Thank you. So just again, we wanted to talk a little bit about the requirements related to Chapter 247 and what's coming. So files will be submitted through the existing MHDO payer data portal. And similar to the claims data, each file will be encrypted and have the same type of format. Files will be evaluated against a set of data intake validation rules. And as Karen Lee said, the deadline for the first reporting period will be August 31st. And we expect files to be reaching a status of passing by then. The other requirement that is part of this is that each payer will be required to electronically sign an attestation that they are compliant with the requirements. And again, that'll be submitted with the data files by August 31st. And this slide is just about how you can let us know who the right people are to contact about this new file type. We had reviewed this back in December, and these changes are already available in the data portal so that you can designate the folks that will be responsible for the non-claims-based payment data. You can identify an administrator, a compliance contact, and data submitters. So if you have not already done that, we certainly encourage you to go into the portal and designate those folks, again, just so that we're contacting the right people as we move through this process. So we had, again, back in late last year, we had reviewed an implementation timeline for 247 that had us beginning to sort of start some of the payer testing tomorrow. Because of these new requirements and the need to make some adjustments to 247, we are delaying that. And we expect to hold another webinar that will review the testing expectations and the process at the end of June. And so that you all can have time to test the process for submitting 247 data in the test portal beginning the end of June through the end of July. And then we'll move those changes into the production portal in early August so that your submissions can begin and be complete by the end of August. So again, we're planning to schedule another webinar in the end of June to go into some more details regarding how we're gonna move through this process. So again, as always, our help desk is available to answer any questions related to the portal. If you are going in there to try and add in contacts or anything else that we can help you with, the information's here. And of course, if you have compliance issues that you'd like to communicate, Filippo knows contact information is also here. So I think now we'll open it up for questions. Karen Lee, I do not see any in the chat thus far. So I don't know if anybody has anything they'd like to pose to the group and come off mute to ask.
So Kate, while people are maybe thinking about this is a lot of information. If we go back to the slide in the beginning that lays out what the statute requires, I just want to take a minute. And, I said earlier, the devil's always in the detail. And my commitment to you all is that we are looking at this and trying to figure out how, again, to translate this into what goes into the file layout. And, what is it that we absolutely need? We totally recognize that, resources are limited. And so there's a lot here. And we're trying to figure out how to parse through this and structure it in the file so that we get what we need, so we can provide the legislative reporting, balancing that with, the burden. And again, to be clear, these are total payments. So we're not looking for member level reporting. This is looking at aggregate data specific to the SUD data that you're redacting before you submit your data to MHDO. And if anybody is interested in chatting offline about this as we build it out, shoot me off an email. I'm happy, would love your feedback if you have any that maybe you are not ready to share here, but happy to talk offline. So with that, are there any questions that folks have? And if you do, just take yourself off mute. And hearing none. And Kate, there's still nothing in the chat, correct?
Correct.
This might be one of the fastest meetings I've had in a year. So I know you all have a million things to do. So we won't keep this call going unless I'll ask one more time. Are there any questions from folks that are on the call?
Yeah, Karen Lee, this is Jan from Anthem. So can we go back one more slide? What is the A requirement of this? Is there one?
I think A is just and we did attach, or the link to the law, I think is in the announcement for this webinar. And we can certainly also post it on the page for data or claims submitters, if that would be helpful. But in any event, I think A is about the actual reporting.
Oh, okay. So if I'm understanding C correctly, though, what your goal is to, in the non-claims based report, you want claims based SUD totals included in there that we have been redacting for years. Is that the correct understanding?
Yeah, we were thinking that it fit into the non-claims based, because we don't get it as a claim payment and we're not asking for it as a line item, individual claim lines. We're just looking for it in the aggregate. So we thought it may just streamline the process for you all to include it in 247 versus having a whole separate file.
And what date range are you looking for?
So all of that will be defined when we reconnect. I believe, if I'm remembering correctly, it is for 2021 or 2020. I can't, Jan, we'll get back to you all. But we're looking for Oh, and I don't want to misspeak. So let me say we'll follow up on that. Like I said, the devil is in the detail, but I don't believe we're asking to go back in time. I think we're looking at this prospectively.
Okay. So, yeah, I mean, I'm totally not clear on how what we've, you know, like I said, the SUD payments that we have, or the SUD claims based, how that is supposed to be summarized and then tied in with non-claims based payments. I'm not following that at all.
Yeah, so I think that that's what we're working on right now in terms of integrating whatever the data elements are into Chapter 247. If it is more confusing, I'm more than happy to have a whole separate file, and maybe that is the way to go for the SUD data. And for the behavioral health non-claims, we just put that into 247. And then for the SUD data, we can have a separate file. It seems to me that there's going to be a lot more text in the SUD data because of the requirement that the methods for how you're redacting is described. And the law requires that within 60 days of us defining the requirements, that the data is submitted. So I mean, I think it's fine if it were in a separate file. We were really just trying to make it more streamlined and integrated, but it doesn't need to be.
Okay, I don't know what more. I need to look at the link you provided, and we will follow up if we have more questions then, I guess. Thank you.
And Jan, I think, and Kate and Phil, correct me if I'm wrong, but I think too, when we actually get to the follow-up webinar and we show you, Kate, if we go to the next slide, I think, just so I get the language right, we are working on incorporating these data elements into the data file layout of 247. And so we'll present that. And if, you know, I'm like I said earlier, happy to share that in advance, Jan, if, you know, if you'd be interested in, you know, sort of looking at it, because if it is more confusing, like I said, and it doesn't fit from your perspective, we can absolutely have a separate file for the redacted SUD data.
Okay, yeah, I mean, we'll have to discuss internally. This just has raised, I just have a lot of questions, but we'll have to discuss internally.
Yep, and that's what we're here for. So, you know, as you start to talk about this, please don't hesitate to reach out. We're happy to get on a call.
All right, thanks.
I'll say one last thing. You know, we, on behalf of our state Medicaid program, we apply the ResDAC list of SUD codes to their data before we integrate it into the all payer claims data. And when we do that, we basically take those SUD claims and we put them, we call it on an island, right? They're locked away on an island somewhere where really nobody has access to. And so for us to total up what we redact, we you know, it's relatively straightforward. We go to the island and look at what we pulled out. And that's what we would total up. So I don't know if when you redact claims, if you are tracking those claims or, you know what I mean? But that's just to throw out there. That's how we, I think, are going to look at this.
And yes, we do. Yeah, we have a file of, what we have redacted based on our SUD logic every month. So basically, I guess what you're saying is summarize that and it will be included with somehow with the non-claims based payments.
Yep, in the file, and Kate and Phil, please jump in because I'm outside of my comfort zone.
Yep.
But in the layout, the idea would be, right, it would be very clear what goes into the buckets for non-claims based. And then it would be very clear about what goes into the fields for the aggregate what's redacted on a total basis. So you take every month, add it up, and then what other additional information is required in terms of methodology and things like that. That will all be defined in terms of how you would submit it in that layout. And now, Jan, I'm way. Kate, do you want to say anything?
No, I think you've got it, Karen Lee. I think, Jan, just the way you said it, it would be sort of summing up what you put aside each month, aggregating it into an annual total, and there would be a couple of columns for you to include that information.
Okay, that helps a little bit. All right, thank you both.
One thing I'd like to mention, Karen Lee, is once we put something together, it would be very nice to circulate it among the payers that will be submitting this data and ask for feedback so that we can do course corrections if possible. As far as the file structure.
Yes. So for anyone that might be interested in that, just shoot Phil off an email. Otherwise, like I said, we are working on over the next couple of weeks what we're thinking, and we'll be prepared to present that the end of, hopefully no later than the end of June. Okay, any other questions or comments? Okay, hearing none. Again, thank you, everybody. I really appreciate it. I know you're all very, very busy, so the time that you spend with us is much appreciated. We will do our best to stick to the timeline and look forward to reconnecting. If anybody's interested again in looking at an advanced copy, please reach out to Phil. Otherwise, we look forward to regrouping towards the end of June. And just to answer the question before you go, the recording and the deck will be posted. Oh, okay, Kate, you did respond to that. Okay, super. All right, thanks everybody. Enjoy the rest of your afternoon.